Bismillah ar-Rahman ar-Rahim, in the name of Allah, the most merciful, ever merciful. This is Dr. Arwa Al-Ojan from Saudi Arabia, and I would like to share with you, dentists, some of my humble knowledge about stress in general and stress among dentists in particular. Now, as all of you dentists know, there is a big lack of information and knowledge in the dental curriculum that was given to us in our undergraduate or even postgraduate studies. No one tell us about how stressful dentistry is, and no one tell us how to deal with this stress, not only to protect ourselves from occupational burnout, but also to provide our patient with a better care. I hope at the end of my lecture you will be able to identify stress in your life and to live with some tools that may help you manage stress better. I will start by defining stress, but before that I want to emphasize here that my talk is about harmful or excessive stress, as stress in a small amount and when controlled is needed and even healthy. It is what motivates us to achieve and protect us from danger in what is known as fight or flight response. Now, what is stress? Stress is a process that causes individuals to believe that they are unable to cope with the situation that they are facing. Stress also is a feeling of anxiety, tension, frustration, and anger that result from recognizing failure in some way and losing control of a given situation. Now, stress is endemic and epidemic today, and dentists are not immune to it. In fact, dentistry has been considered the most stressful of all healthcare profession. And this was according to a study done by Turley et al. He found that dentists in general practice experience more physical and mental illnesses than other healthcare workers. And his opinion was based upon a statistic collected nearly 3 decades ago on dentistry, cardiovascular disease, drug abuse, as well as rate of suicide, which indicated that practice of dentistry is stressful. Now, dentists today more than ever feel that they are subject to high level of stress. Certain factors can cause a serious stress to physical and psychological well-being, and one of the consequences of chronic occupational stress is professional burnout. What is burnout? Burnout is a condition that results from persistent contact with other people through delivery of some kind of service. It can be observed in all occupations, including dentists, physicians, nurses, social workers, and teachers that provide patients or clients with assistance, care, or treatment. It is considered one of the major determinants of psychological incapacitation and receiving growing scientific attention as a result. Now this table is showing the 5 elements associated with burnout. In burnout, you will find symptoms of fatigue, exhaustion, and depression. The symptoms are mental or emotional rather than physical. The symptoms are exhibited among people who have no previous history of mental health problems. Burnout is work-related and work performance is reduced. Now let's talk about the sources of stress in dentistry. There are 4 factors that found to be related to stress in dentistry. Number 1, factors intrinsic to the job itself. Number 2, relationship at work. Number 3, lack of career development. And number 4, other factors. Factors intrinsic to the job: the nature of dentistry, the working environment, time scheduling, new technology, risk and danger. It is all sources of stress in dentistry. Now, the very nature of dentistry as a job has many ingredients that make it the most stressful among all health profession. Now, the working environment, the dental surgery is also causing a lot of stress, although it's not the primary cause of stress in dentistry. Time scheduling also is another cause of stress, as the dentist may find himself need to book more and more patients in order to be able to cover the cost of his dental practice. But this will affect the quality of work he's providing to his patient. The new technology, there is every day new technology emerge, and new advancement in dentistry, and for a dentist to cope with all these new technologies, he may need to attend postgraduate courses, and this is also cause stress on him on her, especially when he finds himself that he needs to block his clinic. The risk and dangers also found in dentistry, this is another source of stress. The materials that the dentist is using, the risk of injuring him or herself, the problem also, the risk of transmitted diseases and infection is also cause stress on dentists. The second source of stress in dentistry is relationships at work. Now, dentists have a wide variety of roles within the dental practice as administrator, employer, and colleagues, roles that may conflict with each other. Lack of career development is another source of stress in dentistry. Now, there are other factors that related to the dentist himself, like his personality or her personality, the past experiences that the dentist went through, the family interactions and child origins, life events, daily stressors, general health of the dentist, social support, number and variety of social roles, psychological needs, individual attitudes and beliefs. Now, responses to stress could be physical, emotional, cognitive, or behavioral. For the physical responses to stress, it may appear in the form of muscular tension, frequent headache, increased blood pressure, overeating or not eating, chronic fatigue, inability to sleep, lack of energy, or even immune suppression. For the emotional responses to stress, it could be in the form of feeling of anxiety, depression, irritability, helplessness, worry, loss of zest of life, or dysthymia. For the cognitive, it could appear in the form of poor concentration, memory problems, intrusive and negative thoughts. For the behavioral response to stress, it could appear in the form of sleep problems or increased smoking and alcohol consumption. How dentists can cope with stress in dental practice? There are 4 approaches that the dentist can use that will help him to cope with stress. It could be physical, behavioral, cognitive, or social. For the physical approaches, he may use relaxation, breathing techniques, exercise, yoga, and healthy diet. Now, for the behavioral approaches, it's very important for the dentist to learn time management skills, problem solving, to have leisure activities, practicing hobbies, and to go into vacations and holidays. For the cognitive approaches, the dentist may use the cognitive restructuring, which is adjusting the way a person thinks. Maybe it is not easy to do this thing by the person himself. The dentist may read some materials that's available on the internet, but if he finds it difficult to be done by himself, he may hire a cognitive behavioral therapist or a psychologist, and he will help him in doing cognitive restructuring. It's very useful. The last approach is the social approaches, which is provided by the family, friends, and the professional support. Now, is there a differences in stress among different dental specialties? There was no significant differences of stress found between different specialty. Does teaching decrease stress level? Many studies have shown high level of stress in doctors, dentists, teachers, and lecturers. Now, doctors and dentists who take on a teaching role in addition to their clinical role may increase their level of stress, but there is also an evidence that this dual role can reduce job-related stress. So more researches are needed to explore this finding. So as a summary now, I can say that dentistry is a stressful occupation with multiple sources of stress that may result in different responses. Fortunately, there are many approaches for coping. Stress management techniques should be introduced early during undergraduate education. This is a picture that I took a few years ago. This is a fisherman on Lake Leman and a beautiful day on the beautiful Montreux. For me, I use photography as one of the approaches that I use to manage my stress as a dentist. I encourage you all to do as much enjoyable activities as much as you can. This will help you a lot to manage your stress beside the other approaches. If you find it useful and you need more information about the approaches to cope with the stress, please write down for me in the comment. I'll try my best to make another lecture about coping with stress, about the 4 strategies. Please try your best to manage your stress as a dentist as soon as possible, as much as you can, because you cannot know how much you are missing until you manage stress. At the end, thank you very much for checking out my lecture. I hope you found it useful. Thank you again. Bye.